I don't want to tell her whole story because that's the point of why we're here today. But after radiation and chemotherapy, she received a stem cell transplant in 1998. And then 12 years later, she began having pain in her ribs, which was ignored. Long story short, they found another plasmacytoma in her body. She received radiation, chemotherapy, tried so many different treatments. But then her hematologist, oncologist explained that there was Velcade XPOVIO, which is Selinexor and dexamethasone, and she began taking it. And I'll let her tell you what happened as she began this XPOVIO treatment. She is grateful for the medications that have prolonged her life. And she's seen her kids grow up, graduate from college, and have kids of their own. And she loves being a grandma. Beth, I'm so excited for them to hear your story. The time is now yours.
Thank you so much for having me. It's really fun to be here and to see your faces. And hopefully my story will encourage you. And I know that all our stories are different, but we have a lot of commonalities. And so I hope that we can have a good time here. And that summed up my story, but I'll give it more in detail. Just a little overall introduction of myself is that I live in Casper, Wyoming, and it's got about 60,000 people. But in Wyoming, we have a lot of space in between our towns. So the next big cities are either Salt Lake or Billings, Montana, or Denver, Colorado. Denver's about a 4.5-hour drive, so that's probably the closest big city for us. But otherwise, we have a lot of small. Casper's the second largest town in Wyoming. So anyway, that's where I'm at. I have 2 kids. My daughter is 29. She lives in Colorado Springs, Colorado. My son is 27, and he lives in Houghton, Michigan. They're both married. I have 2 grandkids and 1 on the way. So that's really exciting. I never thought I'd get to see grandkids. And so I'm just super thankful for that. My husband, we've been married for 30 years, be 31 this August. And he works for the highway department. He's the district engineer here. So he's in charge of everything highway department in his district. So, but I just appreciate him. He is the ultimate caregiver, and he just takes care of me so well. I grew up in Denver, Colorado, in a suburb and in a very healthy environment, not around any kind of, power plants or water treatment facilities or farms or any of those kind of things that sometimes myeloma is connected with. Had a very healthy growing up. So that we just don't know what caused this myeloma, like many of us don't. I went back to school. I'll talk a little bit more about that later. When I was about 40 and got my master's degree in education. And so I had my own classroom teaching 3rd graders here in Casper for about 7 years. And then I just recently had to retire in June. And we'll talk a little bit more about that as well. So we'll talk about my diagnosis here in just a minute, but so I've had multiple myeloma for 23 years. So it started in 1997, and we lived in a small town in the southwest corner of Wyoming called Evanston, Wyoming. It was about 80 miles from Salt Lake City. And just, there's only 10,000 people, so that, you just didn't have access to doctors there like you do in bigger towns. So I was just raising my 5-year-old and my 3-year-old, and I started having pain in between my shoulder blades. And it was just a burning pain, just almost like a pinpoint at first. And it just aggravated me, wake me up at night. It just started getting worse and worse. And at about that time, we were moving to Rock Springs, which is about 100 miles to the east of Evanston on I-80. And it just was getting worse and worse. And I kept seeing doctor after doctor. I saw chiropractors. I saw just general practitioners in Rock Springs, and they kept saying, "Oh, everybody has back pain. If you just do these exercises, if you get these chiropractic treatments, you'll just do better. You'll be fine. You're only 29. You're probably just, having typical back pain." So my first degree, my bachelor's degree, is in exercise and sports science. And I just knew when I was trying to do these exercises, I was like, this is not helping me. This is hurting me. So I stopped doing the exercises, and later we'll find out that that was a really good choice. But so I stopped doing those. And then I started having pain in my sternum that was similar to that. It was burning bone pain, and then also in my skull. And so I kept thinking, there's something serious here. And, but no one would do anything about it. I just kept seeing doctor after doctor, and they're like, "Oh, no, it's nothing, it's nothing." They wouldn't even do any scans. And that was really frustrating to me. But we had heard about a orthopedic surgeon in Salt Lake who would do a scan without having a referral. So we went down there to Salt Lake and saw this orthopedic surgeon. And he sent us right away to go get an MRI done. Well, he just said, "Go get this MRI done. They'll give you the films, bring them back here, and I'll look at them." So he had not heard from a radiologist or anything. And he put the films up on his little thing, and he just wouldn't even talk to us. He just looked at the films. He says, "Excuse me a minute." And he went off to his office to make some phone calls. And then he came back and he said, "We're going to have to do a biopsy." Well, as soon as you hear that word biopsy, you know cancer is in the mix here. And so that was really terrifying. And so he said, "I don't want to do the biopsy in your spine because it's just too dangerous." But they thought they could do it in the sternum, where I was having the same basic pain there. And so they did a biopsy in the sternum that day. And he said, "Okay, go home," which is about a 3-hour drive for us. "So go home and just wait, and we'll call you." Well, this was the week before Thanksgiving. And so he said, "We'll call you within the next week." And so we went home. I had some complications with the biopsy site, had to go to the ER a couple of times. It was a terrible experience. The people were not helpful. It was like I was ready to hear a cancer diagnosis, and they just were not compassionate at all. And they thought I was overreacting. I mean, I think we've all been in situations like that where you just can't get, well, especially in Wyoming, you just can't always get good health care here. So anyway, that was all very frustrating. I was waiting every day for this phone call. My parents were going to come up from Colorado for Thanksgiving. I was cleaning my house. I was getting food preparations ready to go. And but all the while, I had a friend that was so kind. She drove over from Evanston every day until, so Monday and Tuesday, she drove over to sit with me in case the phone call came. And then we just were like, we almost started to give up because the phone call wasn't coming. And so she didn't come Wednesday before Thanksgiving. Well, that's when I got the phone call. So the orthopedic surgeon called me and he said, "As soon as I hang up this phone with you, there's going to be an oncologist going to call you, and she's going to give you some instructions." So there you go. So you had this biopsy, and then you hear that you're going to have to talk to an oncologist. So I knew at that point that it was cancer. So I just hung up the phone and immediately, and this is when we were still using landlines mostly, the phone rang, and it was this oncologist who said, "You need to get to Salt Lake immediately, And I said, do you realize it's a 3-hour drive and I've got 2 small children that I have to figure out what to do with? And she's like, well, take care of it as fast as you can. You need to get here as soon as possible. We'll hold the admissions office open for you. And we just need you here. And so she said, you have cancer. We're not sure a bunch of the details yet, but we'll talk when you get here. So I hung up the phone and I just started crying. I wish now I look back at that, and then I wish I was able to control those emotions a little bit, because I had these 2 little kids who were just at my feet and wondering what was going on. But that emotion had just built up for over a week. Well, and even longer than that, with all the pain that had been happening. And so that was a really difficult time. I immediately called my husband. He rushed home from work. We threw stuff in suitcases as fast as we could. We talked to neighbors who could take care of the house until someone else could handle it. We called my parents and said, don't stop in Rock Springs, go to Evanston, because that's where the kids will be. We hopped in the car, and we realized we got about 40 miles out of town, and there's this, it's called Little America. It's a place where you can stay in the middle of nowhere, Wyoming. But it's also a gas station and things. And so we realized we hadn't let the kids use the bathroom. So we stopped there, and I was able to have some good bonding time with my daughter, who was 5. And we talked about, it's going to be okay. You're just going to stay with our good friends in Evanston for a while. Grandma and Grandpa are coming, that kind of thing. And so I was really grateful for that time. So we did what we needed to do there. We took off again, went to Evanston. The friends that we were going to leave our kids with had called all of our other friends that we knew in Evanston. Then they all came over and just surrounded us and started handing us money, because they didn't know what we were going to face when we were there. They didn't know if Mark was going to have to get a hotel room, or what we had forgotten to pack, which we had forgotten to pack socks. And so he did have to go to the store to get socks. They prayed for us. They just were there to encourage and cry with us. And so that was an amazing time that we really needed, because then we left our children in Evanston and took off for the longest 80-mile drive of my life. And we just didn't hardly talk the whole way, just contemplating what we were about to face. So we get there, and as soon as I walked in the door, they knew it was us. And they said, we're going to send you up to the oncology floor, and they'll let you know what you need to do. So we went up there. The nurse at the desk said, well, your room's not quite ready yet. If you could just sit over here and wait, we'll let you know. Well, while we were sitting there, this doctor walks in, and she says to the nurse, well, where's Mrs. Ayen? And the nurse said, well, she's right there. And the doctor's like, that can't be her. Mrs. Ayen can't walk. And so she walks over to me and she said, can you walk? And I said, yeah, I've been changing sheets. I've been cleaning my house. I've been cooking turkeys. And she said, no, that can't be right. You've got a tumor on your spine that is completely compressing your spinal cord. You should not be moving. And so she said, we're going to get your room ready. I want you to go in there. I want you to lay down. I do not want you to move unless you have to use the restroom. And so that's what they did. They took us into the room, and then we saw the regular oncologist, and she said, this is what we suspect. We suspect that it's multiple myeloma. We saw myeloma cells in the biopsy, but we're not seeing any of the other indicators. So we're not going to give 100% diagnosis yet. They were not finding an M protein in my urine or in my blood. And so they wanted to do 2 weeks of testing on that to see if they could find it, and which they never did. So they finally just, after 2 weeks, they decided to go with the diagnosis of myeloma because of the myeloma cells in my bone marrow. They immediately started radiation on the tumor between my shoulder blades because they needed to take the pressure off. They called me the cord compression. Whenever I'd go anywhere, they're like, oh, is this the cord compression? Because in the scans, you could not see one bit of my spinal cord. It was completely compressed by the plasmacytoma that was growing on my T3 vertebrae. And there was nothing left of the bone. You couldn't even tell that there had been bone there. And I still have that where I have no T3 vertebrae. So anyway, so we did 10 days of radiation in hospital there. My parents came with the kids. They stayed in an extended day hotel. My husband stayed with me at night in the hospital. And so we spent probably about a full 2 weeks in Salt Lake while they were finishing up diagnosis and things. They had to take it to the oncology board at the University of Utah to confirm the diagnosis because they were all just really confused. They hadn't seen this in a 29-year-old white female. The oncologist had said, you don't fit any of the profile. You know, we see this in 60 to 70-year-olds, mostly male, mostly African-American. And we have not seen this. And so they were just very confused and not sure what to do. So they decided I do have to tell you a little story about, they decided to take me over to a neurosurgeon to see what we could maybe do about that T3 vertebrae and how dangerous it was going to be for me to live without that stability in my spine. And the neurosurgeon looked at me and he said, well, we could try to do something. Back then they didn't have the kyphoplasty treatments and the things that they have today. And so, but he said, there's something that maybe we can do, but I'm not going to do it because you're not going to live long enough for it to be worth it. And so that was devastating. He basically said you need to wear a neck brace, especially when you're in a car. That didn't last very long. I didn't do that for very long, but yeah, he said that would be the safest thing for me. But yeah, that was a devastating thing to hear because our oncologist had said 2 to 3 years to live, but to hear someone say it so bluntly was really, really hard. So anyway, so they decided to do a chemotherapy, which was called VAD, and that was the only real line of treatment back then for myeloma patients. And it was referred to as the Red Devil because it was like bright, fluorescent, pinkish, reddish color. And it looked like they were pumping toxic waste into your body. And it had biohazard all over it. You've probably seen those on the bags. It had biohazard all over it. And they would hook me up to it was also called the Red Devil because of the extreme side effects. I was really fortunate. I did lose my hair. As long as I stayed on Zofran, I did pretty good as far as nausea and diarrhea. That's kind of been my trend over the years is I don't have a lot of side effects and I handle the medications pretty well. And so I didn't do too bad on that. And the drugs that were vincristine, adiuromycin, and dexamethasone. So dexamethasone is always the third line of treatment for every single thing that I've done over 23 years. But so it was a little bit hard just with having 2 little kids. We were teaching our daughter kindergarten at home. And so I was homeschooling while I was doing all this diagnosis and chemotherapy treatment. They would hook me up to a pump in Salt Lake. They would send me home and that pump would run for 4 days. And then they'd have a home health care nurse take it out. And then I would come back I'd be off treatment then, except for the dexamethasone, for the rest of the month, and then go back again to Salt Lake. They'd hook me up, and then we did that for about 4 months. And once we did that, it wasn't really working. It wasn't, the lesions in my skull and my sternum were not getting worse, but they weren't getting better. And so they decided that this treatment was just really not working, and that my oncologist in Salt Lake suggested a bone marrow transplant. So we decided to go ahead and go for that because it seemed like the only option. And it was very different back then. We decided not to go to Salt Lake because my parents live in Denver. And so they were able to take care of the kids. We could do the transplant there at the University of Colorado, have a really good team. Myeloma experts were few and far between, especially if you live in Wyoming. So I relied on this transplant team for knowledge and expertise in the area. They were great, and I just really appreciate them. But back then, because VAD was the only line of treatment, you didn't do like I don't even know the terms now, but like you didn't have to do chemotherapy leading up and have your numbers at a certain level before you could do transplant. They just did the VAD. If it worked, it didn't work, and then they would just send you right into transplant. So, so I went to Denver. We had to wait for a bed for about a month. They took my cells out with apheresis, my T cells, and we got enough in about 2 days. And then they put me in hospital, and I was in hospital for 30 days. We were very fortunate because my husband had just switched jobs, had gotten a promotion, and when we had moved to Rock Springs, but they, over the highway department, over all of the state of Wyoming, they donated enough sick leave for him so that he could be with me every day of transplant for those 30 days. And that was typical back then, was a full 30 days in hospital. And they didn't use melphalan back then, they used Cytoxan. So that was the strong chemotherapy that they used to basically kill my bone marrow. And so we did that for about 2 weeks, and then they reintroduced my cells, and they started growing back just great. And I responded really, really well to the transplant. I had to stay about another month after being released from the hospital and in Denver, and then go back and forth to the hospital for testing. And so finally I got to go home. I probably threw up every single day for about a year after transplant. But I was able to take care of my kids and homeschool my daughter and do all the things that we needed to do. And I just got better and better and better. And so I went for about, it's a little bit tricky on the time. I went about 12 to 14 years because I think it came back at 12 years, but we really didn't have a full diagnosis of relapse till about 14 years. But I lived a normal life. I went, like I told you, I went back to school and got my master's degree because the doctors had told us, well, if you can make it 10 years, you're probably going to be cured. And even though, you know, they're still telling us that myeloma is incurable and that it seems to always come back, but they just didn't know. You know, transplant was pretty new for myeloma back then. And they just didn't know what the long-term effects were going to be for transplant. And so, but I just lived a basically normal life. I felt great. I just went back to get checkups every 6 months. And then I started having pain in a rib on my right side. And it would be so bad. Like if I would cough or sneeze, that then I couldn't lay down, I couldn't sit, I couldn't breathe. We even ended up at an ER in a small town in Wyoming. They did some x-rays, couldn't find anything. I went home, saw my oncologist. He did a few scans, couldn't find anything. My light chains, this was a new test at that point, was the serum-free light chains. My light chain numbers were going up, but they were still very low. And we found out later, because he didn't know what my trends were going to be at that point, because it was such a new test. But he's like, oh, they're going up a little bit, but you're still in the normal range, so I'm not going to worry about it. Well, come to find out that even just a small change in my light chains, my kappa and my kappa numbers are really what we watch. If I'm even at a 7, we know that there's lesions. If I'm at a 15, then we know we're in big time trouble. So, but he didn't know this at the time because like I said, we hadn't done the test long enough. But we ended up moving to Casper, Wyoming at the time. And I saw a new doctor here at an oncology center. And he did not like the light chain numbers. And so he asked me if I had pain. And I didn't even tell him about the rib. I was having some pain in my skull and some other areas. But I didn't tell him about the rib because I just thought they just convinced me that it was nothing. And so I didn't even tell him about that. And so he did a PET scan and a couple MRIs on some specific areas. And he came back to me and he said, have you been having pain on your rib? And I was like, yes, but I just haven't told anybody about it. And he said, well, you have a large plasmacytoma on that rib. And it was just frustrating because, and this is a struggle that I've had all through this journey, is that I have pain and I have these things that are happening in my body, and not always will they listen to me. I have to push and push and push and say, this is something. And my oncologist now, we've been together now he's a hematology oncologist here, and he consults with Mayo and MD Anderson and then some people at Harvard. But he has it down now that if I say I have pain, then we better start looking into it, because I know my body and I know at this point what's going to constitute that pain. So anyway, we started radiation on that and some other spots. And then I started chemotherapy, which was Velcade and Cytoxin. And that worked really well for about a year. And then some other things, actually, we stopped it because of the neuropathy that was developing, and because the drug was still working, but the neuropathy was getting a little bit serious. So we stopped it, and I went without treatment for about a year then. So this started about 8 years ago, started a new trend of radiation and then systemic chemotherapy. And so this is what we just followed this cycle nonstop for these last 8 years. And so just a quick run through of what those drugs have been for your information. There's been about 9 different chemotherapy drugs that I've been on, and then 193 radiation treatments from my foot, my ankle, my femur. I've had 2 tumors in my orbital bones, just tons of broken ribs. So I've had treatment all over the place. But anyway, so then after we went for a year off of Velcade, we started with Darzalex and Revlimid, and that worked really well for about 3 years. And I didn't have a lot of side effects. I did find one of the biggest things is I started to develop cataracts from the Dex and from the Revlimid, and that started to become a problem eventually. Let me make sure I'm not missing anything. Then once that stopped working, we did the Kyprolis, and then Dex, and then added Pomalyst because it wasn't really working that well. And that was in December of 19. And then in January, they had to take me off treatment because I started I was in the hospital January, February, and March with pneumonia, and I was missing 2 weeks of work at the time. And they diagnosed pulmonary hypertension, which was caused by different drugs over the years. And so that was a problem. And I was just I was around sick kids all the time, and the germs just made me, it just turned into pneumonia every single time. So that was difficult, and I was going to have to maybe quit teaching. But then COVID came, and I was able to teach online and finish out the year, which was really a blessing in some ways for me. So anyway, so then we went back on treatment, but we had decided that the Kyprolis and the Pomalyst really wasn't doing the trick. So he put me on Implicity. That didn't really work. I was getting tireder and tireder. My light chains were going up and up and up. I had never been above 15 before, and now I was up in the 50s, and then eventually up into the 70s. I started a tumor on my sternum that eventually grew to, and we're talking inches here, a 4-inch by 3-inch by 3-inch tumor on my sternum, and it was just growing like crazy. And so the Implicity didn't work. We went on this brand new drug that just came out on the market called Blenrep. And I don't know how many of you have heard of that one. The biggest thing with Blenrep is it affects your eyes, and it causes cornea swelling and different things. And I found that I couldn't drive. It was just such blurriness, and my cataracts got a lot worse during that time. And so it was constant film and fog behind my eyes. But otherwise, I didn't have any nausea. I didn't have any diarrhea. For some reason, I just really avoid those in my life, and I'm really thankful for that. So the Blenrep, we went about 4 cycles, and it really wasn't working. So my oncologist had heard about this new combination of drugs with Selinexor and Velcade, and it wasn't quite out on the market yet to be sold together. And so he finagled it with the insurance company. I was able to get me going even before it came out on the market on those 2 drugs. And I'll tell you what, it was immediate response for me. After 1 week, I could see this tumor just melting away. It was about half the size after about 1 week on treatment. And then after 2 weeks, it was completely gone. You could not see it. You couldn't feel it. They did a PET scan just recently, and you can kind of see just remnants of it way deep into the bone, but it's still disappearing. And I feel so much better. I have more energy. I'm not having a lot of side effects. The biggest thing is watching my platelets and my white counts and those kind of things. When I had to have cataract surgery, and so the platelets were an issue with that, so we had to skip treatment a couple times. They've reduced my dosage to kind of help with that from 100 milligrams a week to 60. So, but also on Dex and also on Velcade. So anyway, I'm just really thankful and grateful for where I'm at right now, because my doctor, we spoke at a meeting for Selinexor a couple weeks ago, and he was sharing that because he couldn't tell me this, but he was really worried. He was thinking, we are at a crossroads here. We don't know where we're going to go next, and we don't know what options we have. So now that CAR T is on the market, that might be my next step once Selinexor stops working. But we're hoping to stay on it for a long time and that it will work for a long time before I have to do that. So anyway, so that's basically my story. It's been a long journey, but I'm still here and still fighting. And we're going to do what we have to do to beat this thing and hope for a cure. So
you're amazing, Beth. I thank you so much for sharing. And I've heard your story before, but every time you share it, obviously this is the most detailed I've ever heard it, and I'm just in awe of all that you've been through, and you're just, I don't know, I'm just very impressed by you and excited for you about how well Selinexor has been working, and just especially, as you described the melting away of that plasmacytoma, I get so excited for you that, it's not, that there's hope, and that this drug has brought hope into your treatment. So I'm so happy. Thank you so much for taking the time to share with us.
Thank you.
We have about 20 minutes left, which I think is the perfect amount of time. We're going to begin with a group discussion. We're actually going to start the group discussion by taking a poll. So Sabrina is going to pull up some slides for us to describe how to access the polls. And as she's doing that, I'm going to briefly just explain to you. At the top of your screen, if you're on a desktop or laptop computer, at the top of your screen, there's a little white bar, and next to the time is a circle and a square and a triangle circled in the image that you can see on your screen there. You click on that and then click on polls. You should be able to see the poll. Actually, you shouldn't, because I haven't activated it, but now you should be able to see the poll so that you're able to take it. Unfortunately, if you're on an iPad or a mobile phone, you can't participate in the poll itself, but we'd love to see your answers in the chat. Let me give you a little bit, let me explain to you, for those that can't see the poll, what it is. So the question is, what is your association with Selinexor? And the options are, you're a patient on Selinexor, you're a caregiver for someone on Selinexor, you're considering Selinexor for yourself or for someone you love, or you're just joining to learn more in general. So if you could head to the poll section, if you have any questions, or if you can't access it, write in the chat, are you a patient, a caregiver, considering Selinexor, on Selinexor, or are you just here to learn more in general? And we'll wait for those votes to come in. And then based on those answers, we're going to continue our discussion. So I'm excited to hear from you today. All right. So it looks like we have some patients. It looks like we also have people just joining in general to learn more, and we have people considering Selinexor for themselves. So we have people all across the board, which is super exciting. I'll give you a couple more minutes to enter those into the poll, just so we can understand better our audience and continue the group discussion. And I'm also going to close the door so that you don't hear my family. So just 1 minute. It's always fun when you're working at home. All right. So with that being said, it looks like we have people all across the board. I'll keep that poll live in case anybody wants to continue to participate in that. But we're going to start off speaking to those who are on Selinexor. So for those of you that said yes to, you are currently on Selinexor, I want to start the group discussion with this, and you can raise your hand in order to access the raise hand button. If you're on an iPad or mobile, tap the screen. You should see the raise hand icon come up near the bottom. Or if you're on a desktop computer, on the bottom of your screen should be that white bar. There should be the raise hand feature. So for those of you that are on Selinexor or XPOVIO, what do you wish you would have known before starting? And this can be positive, this can be negative. Beth, do you want to start out, and then we'll see who else is willing to participate as well?
Yeah, so the question, tell me the question again.
No, you're all good. So the question is, what is something that you wish you would have known before starting XPOVIO?
Yeah, I think you know, you read all of the side effects and things, but for me, the surprising thing was that, like I told you before, that I have not really had many side effects. I guess the biggest thing has been just a lack of appetite,
Mm.
but that was what was really surprising to me, that I didn't have to have all the side effects that were listed. I was preparing myself, but I didn't know that I could maybe not have any.
Right.
So yeah.
Good. That's great. Thank you. I think that's interesting, right? Because Bob, I know Bob's here, kind of had the opposite where he was like, oh, I've never had side effects before. And then all of a sudden XPOVIO hit him really hard. So Bob, if you don't mind unmuting and sharing with the group, I might have stolen your thunder, but what is something that you wish you would have known before starting XPOVIO?
Well, as you stated, I had gone through all the lines of chemotherapy and had gone through them pretty well, and I didn't have any real side effects to speak of. So I thought that Selinexor was just going to be the next line. I had no idea that I would have such a problem with it initially. We started with 100 milligram treatment per week, and then I wasn't able to tolerate it very well. My my mind was just spinning all the time. I couldn't put two sentences together, and I couldn't think, and that I didn't see as part of the side effects of this drug. So it really
Right.
took me by surprise. I didn't have any of the other side effects to speak of, but this being not able to put two sentences together was really kind of scary.
Yeah.
So we went down to the 80 milligrams per week, and by the way, at 100 milligrams, it was very, very effective. My light chain count dropped by 50%. So it was very, very effective at 100%. I went to 80%. I didn't get any relief from this
Mm.
mind altering experience. So I went to 60%. The drug was still effective at 60%. And so I was really comfortable with it, but my blood platelets dropped out of sight.
Right.
And
Right.
so we've had to suspend the treatment. I've been off of treatment for about a month now,
Oh, okay.
but my blood platelets still are not coming back.
Oh my goodness.
So I'm taking the end plate injections now to see if I can get the blood platelets back up so I can resume my chemotherapy. And I was kidding my wife. I said, "Isn't it funny that all my life I looked forward to having fun and doing things, and today I look forward to chemo." It's funny how this journey takes us through life.
Yeah, definitely. Definitely. And thanks for sharing, Bob. I have been thinking about you, and I'm glad to see you here today. And I mean,
Yes,
I'm glad the Selinexor has been working, and hope that this platelet thing can be figured out so that you can continue your treatment.
thank you.
I think Elise was also on here, but she might have left. So we can move on. Elise, I know, was the other one that said she was currently on Selinexor. So let's move to those who are considering Selinexor. I see a couple people that have entered into the chat that they're learning about next treatments and they're considering Selinexor. What is something that you would like to know? What are questions that you have about the drug, about the side effects? What are some questions that you have that either our patient advocates can answer or our medical professionals that are here can answer for you as well? So you can click the raise hand button again, or because, there's so few of us, if you simply like to unmute yourself and state your question, or if you don't feel comfortable doing either of those, you're welcome to write it in the chat as well. All right. Bob, what would you like to say?
Yeah, this is going to be directed at Julie. Hi, Julie. I've got a question that probably doesn't belong on this worldwide broadcast, but I'd like to talk to you specifically about bone marrow and my blood platelets offline, if we could. Is there a telephone number I can call you? Or?
Yes, absolutely. Yeah. I'll send, Audrey has my cell phone number, so she can,
Okay.
if it's all right with you, Audrey, would you mind sending it over to Bob?
No, ma'am. I can do that.
Thank you.
Thank you so much.
You're welcome.
Awesome. Julie is, well, Julie, do you want to introduce yourself briefly?
Sure. Hi, everybody. And I too see some familiar faces, so it's so great to see those familiar faces. I am Julie Butt, and I am the nurse liaison slash nurse educator for Cario Farm. So we basically have 8 of these nurse liaisons spread throughout the country, and they break us up into regions. So I am part of the Great Lakes region, and I live in Cincinnati, Ohio, but we have the nurse liaisons all throughout the nation.
Awesome. Thank you, Julie. We're happy to have you here today. And we also have Patty and we have Arturo, and they're medical professionals from our team that have come to help with us today as well. So if we have any questions, that's great. If not, I don't want to put anybody on the spot. We can talk about questions that we've had in the past, and then we can also talk about what's coming in the future in this Selinexor chapter, so you can know what you have to look forward to. So for a better understanding, for those of you who are wanting to get more information about Selinexor, and those who are, I guess basically I was just going to repeat what I just said in a different way. But let's talk about the current approval of Selinexor, where it's being used in treatment now. So Julie, do you want to explain at what stages of myeloma Selinexor is approved for at this time?
Sure. So we just got our most recent indication back in December of last year, of 2020, and that's the triplet combination with XPOVIO, Velcade, and dexamethasone. And that triplet regimen patients can actually see at first relapse. So you can get it as early as second line or first relapse. So that's our most recent indication. When Selinexor first came out commercially, that was 2 years ago. And when we first launched XPOVIO to the market, it was only indicated in that relapse refractory setting, more specifically what they call penta-refractory, just meaning you had to be refractory to basically the 5 big myeloma drugs like daratumumab, lenalidomide, Velcade, carfilzomib, those kinds of things. And that was just in combination with dexamethasone. And that was 2 years ago when we first had that indication. But again, fast forward 2 years later, where we are right now, and our most current one is in combination again with Velcade and dexamethasone. And again, patients can get it at first relapse. So you'll see the acronym of that regimen. It's XVD is what that acronym is for the regimen.
Awesome. Thank you, Julie.
Mm-hmm.
Okay, and we have another question. This could be directed to any of our medical professionals. I've heard that Selinexor is similar to Darzalex, and is that right? And is it also active in the same way?
So the mechanisms of action are very different. Darzalex is a CD38 targeted monoclonal antibody, whereas XPOVIO, it's an oral XPO1 inhibitor. So it gets into the cell and causes the cell to arrest, and it produces apoptosis. So they are different classes of drugs, but they are also included in different triple regimens depending on previous lines of therapy that you have had.
Thank you, Patty. And I will add that we have previous recordings from previous sessions in this chapter that explain the mechanism of XPOVIO and how it works in the body. And so we will attach that recording as a resource in our follow-up email that we send 24 to 48 hours as well. Now, here's another question. If we've been refractory to DARA, is that making XPOVIO not useful?
No, actually, that's in real life settings, that's basically how the newest indication, the XVD regimen, is really being utilized. You know, in the indication, it says you can utilize this regimen as early as first relapse, but in reality, a lot of clinicians are using it post-DARA relapse. So they're basically using it third line, this XVD treatment, after a patient relapses on daratumumab. So that's perfect. If you're relapsing, you know, XVD can potentially be your next treatment.
Awesome. Thank you, Julie. I think just from what I've learned, and I will say I'm definitely not a medical professional, so I'm just sharing my opinion when I say this, but I think a lot of success that comes from XPOVIO is because it works in a different way than other chemotherapies do. And as I've been learning more things about chemotherapy treatment in my studies, I've learned that because it's so different, you can be refractory to other classes of drugs within the chemotherapy umbrella, but you could potentially, like Beth did, like Bob did, you're refractory to other treatments, but you're able to have success with XPOVIO because it works in your body with such a different mechanism in such a different way. So it's exciting to see this progress made in the field. What about if you've relapsed on Velcade? Does that affect the XVD treatment?
Yeah, that's a really good question. And I don't really have a good answer for you, to be honest with you. We had patients that were in the clinical trial that had been on Velcade before and were still able to see efficacy with the XVD treatment. So if you have, and I'm not quite sure how long ago you were on Velcade, if you just recently progressed when you were on Velcade, or if you had seen Velcade in the past and are progressing on a different regimen. I'm not quite sure where your Velcade is, but the information I'll tell you is that what they have been able to find out with clinical trials is that XPOVIO has a synergistic effect with Velcade. It basically re-energizes the proteasome inhibitor, and when they work in conjunction with each other, it allows the efficacy that you see in the clinical trials. So in some instances, patients can be refractory to proteasome inhibitors in prior therapies, and when they get placed on the XVD regimen, they're seeing efficacy in the combination with both the proteasome inhibitor and XPOVIO, because they have this synergy between the two of them. I hope that answers the question.
Thanks, Julie. I thought that was clear. I hope that it answers your question. She said that she's been on it for 4 years and just switched to Kyprolis and Pomalyst. So,
okay.
So thank you for your participation. I appreciate all of you and taking the time to be with us today. We're going to close out with a few announcements. Thank you, Beth. Thank you, Julie. Thank you, Patty, Arturo. Thank you also, Maru and Sabrina, for helping us today. For all of you that participated and came to join us, it's such a pleasure to have you here. And it helps me so much in my job to have your support and your great feedback as well. Our next Selinexor support group chapter meeting will be on May 26, 2021, and we'll be talking about managing major side effects when on XPOVIO, and that's going to be with Molly Oswald. She's a registered nurse. Sometimes XPOVIO was approved by the FDA, but with a high side effect profile, and patients have oh my goodness, I don't know why my mouth isn't working, have reported significant side effects sometimes with this drug. So we're going to be talking about how to manage major side effects at that time. And then you might be interested in other upcoming myeloma crowd community events that we have. Tuesday, May 4th at 1 p.m. Eastern is our Myeloma Financial Coach chapter, and that's going to be on housing and rental laws. That's going to be with our Myeloma Financial Coach chapter, Diana Valentine, and attorney Stuart Pope. And they're going to be discussing this topic in terms of those with disabilities. And in this case, myeloma is classified as a disability. This is especially pertinent in areas of our country where there's lots of foreclosures, where there's lots of evictions happening right now. And even if you feel that this topic doesn't apply to you, I would encourage you to join so that you can spread the news with others in the myeloma community who might need this, or who perhaps have other disabilities that might benefit from hearing this topic. Wednesday, May 5th at 7 p.m. Eastern is our Fitness for Myeloma chapter. The topic will be the importance of strength training, a call to action. And Lindley Sweeney, our chapter head, will be giving us a live demo of strength training workouts we can complete at home. And thankfully, she'll also be including modifications for those of us that need it. So all fitness levels are invited and encouraged to come to this event. Thursday, May 6th at 1 p.m. Eastern is our stem cell transplant chapter. This is a new chapter that we launched last month, and we're so excited to announce our second session in this chapter. Whether you're going to have an inpatient or an outpatient procedure, or maybe they're simply considering a stem cell transplant, learn which items you'll need during those first 30 days. And for those of you who have already had a stem cell transplant, which I imagine would be many of you, you can come to this meeting and also give your input on what are things you wish you would have brought, or things that you would like the next generation of myeloma patients to know about what to bring for a stem cell transplant procedure. That same day at 2:30 p.m. Eastern will be our Intermountain Myeloma chapter event. Specialists from Huntsman and Salt Lake City, Utah will be coming to talk to us about how to improve quality of life for myeloma patients in survivorship. The link to sign up for any of these events and even more events that I haven't mentioned today is found at the bottom of this slide and will also be sent out in our follow-up email on Monday. Another thank you to our sponsors: AbbVie, Bristol Myers Squibb, Amgen Oncology, Genentech, Karyopharm Therapeutics, Oncopeptides, Adaptive Biotechnologies, Takeda Oncology, and a thank you to you again. I know I've already said this, but having us build this strong myeloma crowd community together means so much to me. So thank you for your participation, and I hope you have a great rest of your day. Thank you so much. And thank you, Beth.